If you are the leader, press star now.
The topic of this YouTube broadcast is PACU nursing, and we expect it will take about 40 minutes or less to go through our demonstration. Before I begin the demonstration, I'd like to give everyone a quick overview of what we're hoping to achieve with our broadcast and make sure we have all of the same expectations. First of all, a reminder that the broadcasts are meant to demonstrate the part of the model system that the design team is working on during each 2-week design session and is not the finished product. The goals of our broadcast are to share and validate the system and clinical content with working health professionals from VCH, PHSA, and PHC, answer questions from participants about the design work in progress, identify areas of concern based on our 4 criteria for making design decisions, which are safety, regulatory, or financial or content. So safety are changes that have safety implications. Regulatory are changes that are required to fulfill regulatory obligations. Financial are changes that will have significant operational cost considerations. And then content is content that does not exist in our model system, but is required. The broadcast focuses on current work only. It's not a brainstorming session or an opportunity to suggest additional features, but we do appreciate your feedback. And we'll do our best to answer the questions during the broadcast, but we may need to park and lot some and follow up at a later date. And then one last thing before I begin, I'll ask that you please hold your questions until the end of each of the parts of the demonstration. So we'll open it up for questions at certain parts. And then we'll have a time at the end as well for questions. And I'm going to go ahead and get started. So this is week 2, so we're looking at the PACU nursing, and we did take some of the feedback from last week. And have incorporated into both our workflows and into the domain. But I do want to point out that some things within our domain are still a work in progress. So I'm going to start my workflow, and we're looking right now at our CST periop PACU workflow. This has 3 swim lanes, and I hope everyone can see. I'm displaying it on my screen. There's 3 different swim lanes, the anesthesia provider, and then if I scroll down, we have our PACU RN, and that's the focus of this sprint. And then we have our procedure physician. So I'll go through the workflow for each of our swim lanes, but just when I do the demo, I'll only be looking at our PACU RN portion of the documentation and workflow and their role in this. So starting with my anesthesia provider, the patient arrives in the PACU. The anesthesia provider will assess the patient and see are there any ad hoc post-op anesthesia orders needed. If yes, they would open up their anesthesia post-op standing order power plan and enter those ad hoc orders. If no, then they would complete their handoff and communication with the PACU nurse, complete all remaining documentation requirements on the anesthesia record, including their signatures, and finalize their record. Any data that hasn't yet posted from the anesthesia record would be posted to the patient's chart, which includes meds, fluids, the patient's vital signs from the anesthesia record that haven't yet posted because it is sending information incrementally, but it could not have since the last 15 minutes or so. Any charges for anesthesia will be automatically generated. Once the patient's ready for PACU discharge, the anesthesia provider will complete a post-op note to indicate the patient is cleared for discharge from PACU. And so we'll be looking at this workflow a little bit more in depth in our sprint 15. So that's in, I think, 3 weeks away, because we'll be looking at that post-op note. All right, so for my PACU RN, their portion of the workflow, when the patient arrives in PACU, they're going to complete a PM transfer to the phase 1 bay. So this moves my patient's location in the system from the OR to the phase 1 bay. And I do want to note that this step could be performed by a PACU clerk if there is a clerk in that department. Then they would chart the PACU arrival on the PACU record, which is going to update the patient's status on the tracking board. They'll discontinue any intra-op orders and initiate their phase 1 orders on the anesthesia and surgeon order set. They'll associate the patient to a PACU monitor, complete the handoff communication with the anesthesia provider, activate and chart flow sheet assessments, and then just a note, because we did associate that patient to that BMDI monitor, the monitored vital signs will auto-populate. Our PACU RN will complete all of the orders and actions that have been ordered by the anesthesia and the surgeon. And one order type that we specifically called out was our medications. So if there are any medication orders, it depends on if the medications are available in the PACU or not. If they are, then they would go through our medication administration wizard to document and complete those administrations. If not, they'll obtain the meds from pharmacy before they do the medication administration wizard, which involves scanning of the patient's ID and medication for closed-loop medication administration. Our nurse is going to chart any additional PACU record data, including the patient's acuity, and they're ready for discharge time, which will update our tracking board. And then this next part goes through a few different workflows. So if the patient is an AM admit, they will contact registration with a bed request and receive their bed assignment. And if they're not, they would discontinue their PACU power plan and initiate meds rec, and disassociate the patient from their monitor. If the patient's going home, then they would send complete the transfer home, and if not, they'll send the patient either to their assigned bed or to their phase 2 recovery, and complete the appropriate handoff with those nurses, and chart the discharge from PACU time, which will update our tracking board, and finalize their PACU record, which is going to send any related charges based on that PACU documentation. Okay, which ends our PACU nursing workflow. And then our last swim lane is for our procedure physician. They're going to perform their immediate post-op note when the patient arrives in PACU. Are there any revisions needed for their PACU or post-op orders? If yes, then they would update their orders by removing or adding those orders to their to the order set in the plan state. And then the next is a decision: is the patient going home or are they going to a hospital bed? If they're going to a hospital bed, they'll complete their admission order med rec and place it in a plan state. And if they're going home, they would complete their discharge order med rec and place that in the plan state and print any needed prescriptions at that time, which would complete their discharge phase of their PACU phase 2 order sets with any specific discharge instructions. Any questions about that workflow before I go into our domain to look at our nursing documentation and workflow? All right, so I'll go into our domain and I just make sure I have the right one open. Okay, so here we are. We are logged into our Power Chart application as a PACU nurse. The first screen I see is this peri-op tracking board, which is a list of all of my which has a view, and that view it has a list of all my patients for that day. At 11 a.m. today, we have a session where we're going to review the design of these tracking boards. So right now it's sorting my patients by their room and then by the patient name. So I would go ahead and find my patient, and this is my patient that I'm looking at today who had an appendectomy, and I can see on their status that the patient's out of the OR room, so they're heading to me in the PACU bay. So I'm going to go ahead and double-click to open up their chart. My first step is to complete a transfer from the OR to my PACU bay, and I'm doing this as a nurse, but this also could be done as the PACU clerk. So I did PM conversation and clicked bed transfer. Then I'm going to choose my unit, and I'll just choose my LGH PACU. I think I chose the wrong one. I chose the wrong one, sorry, LGH PACU 1. And then I would find my PACU bay that the patient's going to. So I'll send my patient to day 20. Okay. And I'll go ahead and complete my transfer. So if I do a refresh, I can see that my patient's location updated from their OR room to their to the PACU bay they're located out at Lionsgate Hospital. The first screen I see in my patient's chart is this perioperative summary, and within our perioperative summary component, we have different types of summaries. So we have one for pre-op, intra-op, and post-op. Our intra-op summary is designed to help with the handoff between the intra-op nurse and the PACU nurse. So it's designed to be a chart summary of that patient. So I can see here it has my procedural information for that procedure that my patient has performed, relevant vital signs and labs, the patient's height and weight, intra-op summary, so if my patient had dressing and packing, implants, cultures and specimens, any patient care devices and tourniquets. If anything was documented in the OR record, that would flow here to my intra-op summary. And then their allergies, diagnosis and problems, any home meds plus medications that they're on, and then their documentation posts here as well as the patient's relevant histories. So for example, for documentation, if I needed to view that OR record, I can just click here and it would be a summary of my OR record for that day. And here's that OR record report. Let's go ahead and close out of that. So as a PACU nurse, the first thing I want to do is go into my peri-op doc and open up my PACU record. And then I'm going to mark that my patient is in PACU. And I'm going to come here and chart my acuity started and then choose my acuity level. Now, one thing we do have as a follow-up later is or one of the follow-up questions from last week was where these acuity levels were coming from. These came from the Intermountain defined acuity levels, and then if you choose outlier, they have a list of outlier reasons for you to choose from. But when I followed up with the model team regarding this list of acuity levels, they said this can be localized to the site. So if we have if we can provide a list of acuity levels, we can change these. In a model, they're actually going to be moving back to acuity levels 1 through 5, which drives a lot of charging in the U.S. Let me go ahead and just say yes. So I've started my PACU in time and started my acuity charting. I want to go back to my peri-op tracking board just to show you that by marking my time, my patient is now showing as in PACU. Okay.
There it is. Sorry to interrupt.
Yeah.
We can't see that part when we get to the screen.
Sure. So Carol, you might need to scroll on your live meeting to see the status column.
At the bottom.
Status?
The status is way over there. So you have to scroll over.
I've gone as far over as can see.
Yeah,
the bottom.
me too.
Yeah.
Can you see it now?
Yeah,
thanks.
Thank you.
Okay. Okay. I'm going to come over here or to my iView band, and I'm going to actually do the associate of my monitor. But I do want to point out that we don't have any active BMDI monitors, so I just, what our nurses would do is they'd click this associate monitor, and then what would pop up with the monitors in that PACU bay, and then they would select that monitor to associate to. But because we don't have anything set up, there's that screen doesn't go anywhere. That would start my automatic charting of my patient's vital signs. So I'll go ahead and just start to manually do my charting in my PACU band. So I'll mark that my patient has arrived. My patient's initial positioning. I'll start charting my vital signs. And so one thing about iView is if you double click on the top of your band, it opens that up so I can just start charting my vital signs. And these should be automatically coming in on my BMDI monitor, but I'm just going to go ahead and chart these manually since I don't have them. Once I've completed that, I'll do my airway. So I've done my pain assessment. I go down to incision and wounds. So some of these things, like for example, incision wound skin is what we call a dynamic group. So what I would do to start my incision wound skin charting is I would click here to create my dynamic group. And then this is what's creating my label. So I have different selections within my dynamic group to create my label. So for example, incision wound location, I would choose my location, laterality, and then any additional incision wound description, or if there was an incision wound finger or toe, there's an additional. So none of these are required fields, but you would build your dynamic group label based on what you were charting. I'll say OK. And then that label created what we call dynamic group. So I chose left abdomen as my incision wound. And then this opened up all of the underneath fields that you can chart for that incision wound. So then I can just double click and saying I'm assessing my patient. I would chart if there's any abnormalities for that different incision wound. So I'll just go through and chart this one. So there's no abnormalities. Okay, and once I've completed the charting for my incision wound, I would just click the pencil to sign off. But if there are multiple wounds on my patient with this dynamic group, what I would have to do is create another dynamic group to chart on that one. So if there was another wound, I can minimize that and then create another one. I'll just create one on my right abdomen just to show you how that would look. And then what that does is there's two different incision wound charting, and I would address both separately in their dynamic group, if that makes sense. And so there you can see throughout our iView charting, incision wound is one example, but for example urostomy, there's another where you would create your dynamic group for specifically what you're charting against, and then you would let's just say nephrostomy, and then you would chart the assessment below that dynamic group. And same with our surgical drains and tubes, another example. And we'll look at the actual design of these iView bands for the sections that we own later today. I know we started some of that last week. And we'll also look at when we're going through our iView bands, what sections we want to see in our iView bands, in what order we want those sections, and then what specific fields we want turned on for viewing. Okay. And so we have different iView bands. We have our Peri-Op Quick View, which is designed for for doing the PACU assessment, and that has all of our it should have all of the different bands that are designed for your typical PACU charting. Then we have Peri-Op Systems Assessment, which I'm saving my results. which would have all of our, we're able to do a full systems assessment on my patient in PACU. Carry-up safety departures for when the patient is leaving the different phases of our PACU and phase 2 documentation. And then peri-op lines and devices is for charting on different lines and devices that we see in PACU. We also have intake and output bands, which we'll see as the I&O totals of our patient, and then our adult education and pediatric education bands. Now for the next part, I'm going to go through how we would initiate orders. In PACU, we're going to discontinue our intra-op orders and initiate those PACU orders. So if I look at my patient's orders on their orders profile, you might need to scroll over a little bit. We can see that there's an anesthesia order set and then there's a surgeon order set. And right now I see that we have an active intra-op orders on that patient. So what I'm going to do is go ahead and discontinue that because the patient has left intra-op. And I'll discontinue that phase of care. I'll put in my surgeon's name. And then I'm going to initiate their phase 1 orders. And I'm going to initiate my anesthesia phase 1 orders on my anesthesia order set. And I should be I'll give my anesthesia provider's name. So I'll do orders for signature and sign. This should have been filled out when we signed the order. So if I refresh, I can see that my intra-op orders have been discontinued, and then my phase 1 orders for my surgeon order set and my anesthesia order set have been initiated. Now for this next part, I want to show how the medication administration would work, but I'm actually going to have to navigate to our other domain. So I have the same patient prepped in that domain because we have currently no meds associated in prod, so I can't show you this step in prod. But if we look at my patient's orders profile, we can see that I also have their phase 1 initiated and my anesthesia phase 1 initiated. So I just wanted to show, so my patient's in the same place in dev, but we have active meds, so I can show this part. So if I was doing my iView charting, and I'm going to be also administering meds for my patient, what I'm going to use is my medication administration wizard. So this is where we would scan our patient's wristband, and then by scanning the wristband, it will bring back my active orders profile. I'm just going to go ahead and bypass our scan because I don't have a patient's wristband to scan. And then this shows me all of the active orders on my patient's chart. And so then I would go through and I would scan each of those med products, and then that would identify that those are being scanned. I don't have any meds to scan, so I'm just going to go ahead and click on the ones I'll mark as me administering them. It's saying I'm not verifying these by scan, and that's okay because I don't have that. But you can also manually chart them. And then you can see here that I have some, these are marked in yellow, so I need to have some additional fields that I need to sign off on before I can complete those administrations. And for here, I'm starting a epidural infusion because I wanted to show how this will flow into our IV band for charting. So I'm going to go ahead and sign off on these 2 meds that I'm administering. And I'll refresh my screen. If we go to my patient's MAR, or medication administration wizard, and I refresh it, you should see that I have 2, or the medication for that I administered have been started. So you can see here my begin bag for my continuous infusion, and then my acetaminophen has an administration. So that's coming from what I just did. So my medication administration will automatically update our MAR, which is the source of truth of our meds. And back in my iView, I also want to show that if we go to our peri-op lines and devices, we have this IV. I need to refresh. It's interesting. It's not coming through. So what should happen, and it was working yesterday, so I'll follow up with the pharmacy, but by documenting the starting of that continuous infusion, that should flow through to our IV drips section, and so we can change the administration for that product or document the rate and the amount that's been administered in that IV drip section. And I will, after this broadcast, I'll follow up with our pharmacy team to see if we can show that later today, because that was working yesterday.
Have you like opened up the dynamic group and made an IV though? You know what I mean?
Sorry, I didn't hear your question.
I just said like, have you like started an IV, like an IV drip in that there? Like, I think if you don't open up that dynamic group, it doesn't flow through, right?
No, it should be following through based on my documentation of a continuous infusion. Okay. So your IV drips should be where we're addressing our administration or our amounts for those IV drips. But then we also have our advanced pain modalities, where this is where we'll document our remaining charting around our epidurals. So if I'm charting my epidural, I would create a dynamic group for that. It looks like one's already been created for this epidural catheter lumbar, but it's similar to any other dynamic groups where we would click the add, and then you would select your label for that dynamic group. Okay. That created a new dynamic group for me, and then what I would do is double click to open up that chart. I'll just say
Meredith, are we only seeing the dermatome level as a one level because we selected lumbar, and if you select thoracic, you'd get an upper and lower dermatome level?
No, it looks, so for dermatome, this is a multi-select, so it's not, this won't change based on our selection of our label, but
Okay, so then
it would,
okay.
you would, for your dermatome, you would select if it's the multiple, if it's upper and lower.
Yeah, but you need, yeah, I mean, okay, we'll talk after, that's okay. You're away from here.
Okay. So once you've completed your charting for that, you would click the sign to sign off. Okay. So our workflow, just to highlight for PACU, is we would continue to do our assessment in our peri-op quick view and our different remaining IV bands. And we'll be getting that continuous vital sign charting. I know one thing we talked about was adding the Pacero score as our sedation scale, and that we have submitted a request for that, but we haven't, our dependencies haven't been completed, so we haven't been able to pull that in for that charting. But I'll go ahead and just document them already phase 1 score, but we do know we have submitted the request for that Pacero. Go ahead and sign off. So I see that my patient has met my already score for phase 1, and so they're now ready for discharge from the phase 1. And for my case, my patient's going to be going to phase 2. I'm going to go actually back into my peri-op doc, and I'm going to chart that my patient's ready for phase 1 discharge and that they've actually been discharged. And I'll come here and I'll document my acuity stop time. And that's all I need to do to complete my PACU record. You can see here that I don't have a supply tab because we removed that because there's no supplies charted in phase 1. It was just phase 2 based on our feedback from last week. So I'll go ahead and click the Finalize tab to finalize our document. Then if I come over here to my Peri-Op tracking board and click Refresh, you should see that my patient has been shown to be out of PACU. So that status will also update our board. And then one last step I want to show is if in our IV we do have that safety departure band. So in the Peri-Op, they would document their safety departure. Go ahead and sign off on that. Okay. All right. So I'm going to come out of my patient's chart. And I'm going to go back to our workflows. So we'll look now at our phase 2 workflow. References are, it starts from the Peri-Op PACU workflow, and the patient has come from PACU to our phase 2 bay. So our nurse, or if we have a clerk in the phase 2 area, they can complete a transfer to the phase 2 bay, discontinue the phase 1 orders, and initiate phase 2 orders on the anesthesia and surgeon order set. Open up the phase 2 recovery record and chart the arrival time, which will update our tracking board. Chart the initial set of vitals on the IV flow sheet. Provide light food drink to the patient and monitor their nausea. Is the patient ready for discharge? If no, then take the appropriate action. And if yes, chart their vital signs before discharge. Perform the discharge step via the discharge summary, which are patient education and follow-up. And then chart any item usage and save the case pick list. And enter our discharge time and finalize our phase 2 recovery record, which would send any potential charges, and the patient is discharged home. So if we come into our domain, I'm logged in still as the nurse, so I'm going to come here to my post-op tracking board view. So this view is separate from the PACU one, so we can customize these columns as appropriate, and also change how the patients show up on the board based on where they are in that phase of care. But I can see, and if I scroll over, you still may need to scroll over, you can see that that patient status has been flagged on the board that they're out of PACU, and so they've been, they're being transferred to phase 2. And I can also see that my patient's location is PACU 1, but when I complete my PM transfer, that should update as well. So I'm going to double click to open up my patient's chart. And the first screen I'm on is my Peri-Op summary, which is again that summary of my patient's chart. I'm going to my post-op summary, which is designed to be a handoff when the patient's leaving one recovery unit to the other. It has my procedure information, very similar to a post-op summary with pulling some implant information, some pain information from our PACU charting and also the intra-op charting. The patient's vital signs, allergies, diagnosis and problems, lab measurements, their home meds, and their documentation. One thing about our summary is it's designed to be a summary of the chart, but if I click on a specific section, so for example, if I wanted to go to the allergies tab, I would just click on the header and it would take me right to my allergies tab in my patient's chart, where I can make an update or also see a little bit more detail about when this was last reviewed and who reviewed it. So first up I'm going to do is when my patient's in phase 2 is I'm going to complete that transfer so that the system knows where they're located. So I'll come here to my PM conversation, select bed transfer. Now I'm going to select my PACU 2 unit and choose my appropriate bay. I'll put them in bed or bay 1. Click complete. If I refresh, we should see that my patient's location has changed to that PACU2. The next thing I'm going to do is I'm going to come over here to my peri-op doc, navigate to my phase 2 record, and I'm going to chart that my patient's in phase 2. Start my acuity. I believe last week we talked about not having the acuity in phase 2, so we'll make sure that those are all removed. And then the majority of our charting occurs in that eye view band. So I'll just go to my peri-op quick view and chart my initial set of vitals. Sign off on my vitals, and then continue my patient's assessment. So it's the same areas where we do our phase 2 charting as in our different eye view bands. I'll navigate over to my orders just to show that you would be discontinuing our phase 1 orders and then initiating our phase 2. I'll go ahead and discontinue my phase 1 orders. And initiate my phase 2. Then I'll discontinue my phase 1 orders in my surgeon order set. And initiate my phase 2. So if I refresh, you can see that my orders are now active. My phase 2 order plans are active. So I would carry out those orders as necessary, and again, administering any meds through our medication administration wizard with the scanning of the patient's wristband and the medication. And then I'll go ahead and chart my Aldrete score, just to show for Aldrete too. So you can see here that my patient is now ready for discharge from phase 2. And I've carried out all of the appropriate orders as needed. So what I'll do is I'll go to my patient peri-op doc. I'm going to mark that they're ready for PACU2 discharge. I'll mark with their acuity. I'm going to chart any supplies that are going to be used. This would be, I think we identified crutches or other supplies that potentially would be used. I can mark those off, and that would be associated with the patient's chart for any charging. We don't have any supplies currently built in prod, which is why it's pulling back a blank record. For my orders, I can go ahead and I can discontinue my phase 2 orders and initiate the discharge ones from my surgeon. So my discharge phase of my order set includes that discharge patient order and then any communication orders for discharging and their activity, diet, instructions, wound care, etc. So any orders that they need for going home. So when I refresh, I can see that these are now been initiated. And then I do track my patient's discharge readiness on my discharge readiness component. And as the nurse, I'm responsible for the follow-up and patient education. So one thing for the patient education, this is going to be living on paper in the future state. So I can check or complete my follow-up and say when my patient needs to be seen. And we'll just say we'll need to have them follow up with their surgeon. Within 1 to 2 weeks. This would link to that provider's addresses, but I'll just, I don't think it one's been loaded for this provider, so I'll just go ahead and say okay. So that's been documented. I do the patient education, and then I would just confirm that they have a discharge diagnosis, and that discharge order has been completed. And if there's been a discharge meds rec, I could initiate that meds rec from here. I don't think we have one signed currently. And I'm going to navigate back to our other domain dev for my same patient because it doesn't look like our discharge readiness has been configured with the readiness scale. The discharge readiness scale, it shows me that all helps me track when my patient's ready. So when my med rec has been completed, this would fill in. Same with our provider documentation for discharge. When we've completed our follow-up, this circle would fill in, and then when we've completed our patient education, we can click here to check off that's complete. When there's a discharge diagnosis and a discharge order, both of those will fill in these boxes. And so then I know I'm ready to review and sign our discharge summary with our patient. So I'll click review and sign. And then this launches my discharge summary. And then I can go ahead and click sign and print, which would print out that discharge template. It's telling me in my domain that I haven't completed the diagnosis, meds rec, location understanding, which is down here. But so it's not going to let me actually print it. And that's because we're only doing part of the demo, so we're doing the nursing role and not the provider. But by clicking review and sign and then printing off that discharge summary, it would include a summary of the discharge template they give to the patient. And they come back into my prod domain, which is where we're doing the bulk of our documentation. And then I'll just mark in my case times that my patient has been discharged from PACU2 and finalize this record with my green flag, which would complete our PACU2 workflow. Okay. And that ends the demo of our PACU and phase 2 nursing workflows and documentation. So I'll go ahead and open it up for any questions.
No questions in the room? All those calling in, any questions for Meredith?
Do we want to, I think last week during hands-on we had a few questions, so we could go look at that before we complete. I could put that up. Okay. All right, I'll go ahead and go through. I think these are a few questions that people had from hands-on of last week, so we can go through the responses for that. And then we'll, and then if there's no more questions, we'll end our demo. All right, so one of the questions from hands-on was, will there be only one place for the timeout information, where we have all the timeouts? Then the current answer is the timeout documentation will live on our intra-op and intra-procedure surgery documentation for our scheduled procedure cases. So the PACU-RN can view that by opening up our intra-op record from the in-page view or in the documentation tab in our table of contents. So if I go back to my peri-op summary for my patient, make sure I'm in prod, yeah. And then if I go to my patient's documentation, if I open up my intra-op record, this should house that timeout documentation. So I would just go to my patient's timeout, safety checklist timeout, which would include that timeout documentation.
I'm not sure why anyone would want to ever do that.
I don't know why you wear it.
Yeah, but it's nice that you can, I guess, but I don't know that it would.
Okay.
Anytime you want to do it, check it out. Like as a PAC, you don't care. You're auditing.
The next question was, when emergency medications are ordered and signed by the nurse, will the ordering provider be notified to sign? And yes, that's correct. So if we are doing any emergency meds, we can enter them as the nurse as a verbal order with that, and we would select the provider who's ordering those meds, and then that would go to their message center, and they would have to sign off on those verbal orders to complete that order. So our next question is the glucometer part of the point of care assessment? And I think, I think the point of care assessment section is not actually owned by our team. So if I go, but it is owned by ClinDoc, and so the design for that has not currently been completed, but they will be reviewing what tests with the lab team need to be available for documentation and that we can enter as point of care results. So I guess the answer to that question is to be determined, but we can follow up with the lab team on that. And then the next question was, could the warning about when to not sign chart be set up better? I think the warning is hard-coded, so if let me just minimize this. If I go into iView and I have unsigned results, so I'll just go ahead and document a few results on my already to show you. And then I try to close my patient's chart. I'm going to be warned that you have unsigned results. In the PACU Quick View section, do you want to continue? And I would say no, and then I would go and navigate back to my PACU Quick View to sign off on them. And that warning is hard-coded, so we can't change that. But you should be warned if you try to navigate without actually signing your results. Okay. Can the order of the sections be changed? Yes, and I think we've already reviewed this order with, in our prod domain, but we'll be reviewing that again later this afternoon just to confirm that it's correct for all of the sections within our band and sign off on the order of those. And then the last one was, there was an issue last time when selecting the faces pain scale, a diagram pulled up and prompted, but you couldn't enter a value. And I think that's broken in our dev domain, but we'll be working in prod, and I did notice it was fixed in prod. So if I come to my pain assessment and go to my faces pain scale, you can click here to see the actual pain scale reference material. I'll close out of the screen. Okay, but I can also double click here, and there is in prod you're able to select a score. So that's been fixed. And I think that was all of the questions that we had from hands-on from last week, unless anyone else has anything else.
I have a question, actually.
Okay.
If you don't physically move your patient from phase 1 to phase 2, can that piece be bypassed? Like if they stay in the same bay for both phase 1 and phase 2?
Yep, that's fine. So this is just telling us where the patient's location is in the system, but if they're staying in the same location, then we wouldn't need to do that step.
Okay.
Yep. And this step is for like for pharmacy or lab to know exactly where the patient's located. So you would still need to do the peri-op doc step where we're updating the times to show the different stages that the patient is in, which will flow to the tracking board. But if the patient's location does not change, then we don't want to change their location in the system.
Right.
Yeah. Okay. Any other questions? All right, I'll go ahead and read our ending script, and then I'll stop our recording, so we can upload this to YouTube. All right, so, okay, that's all for today. If you joined us late, you can go ahead and rewind to the beginning of the broadcast, which has been automatically archived. You're welcome to share this link with your colleagues, but we ask that the broadcast not be shared outside of our health organization. And then our next live broadcast will be September 14th, 2016, and the focus of that one will be procedural sedation. And we'll send out the exact time and YouTube link with the next correspondence. So for a link of all of our archived broadcasts and the schedule of the upcoming live demonstrations, please visit our cstproject.ca/SME, which is SME, and the password is CSTSME in all caps. And then if you have any other questions or concerns or ideas for how we can improve our future broadcasts, please email us at patricia.rutherford@vch.ca. And thank you for joining us today.